Hi, I'm Bree. I'm a speech-language pathologist and a vocal coach, and I'm excited to be here with you as you begin your journey with respiratory muscle training. Let's get started. If you've not unboxed your breather voice, go ahead and do that with me now. You'll notice the breather voice is put together with the standard mouthpiece. It's ready to go. There is also a smaller mouthpiece that can be used if it's more comfortable. Let's go ahead and take a closer look at breather voice. You can separate the mouthpiece from the body of the device, which you would do to clean it or if you wanted to use the smaller mouthpiece. You'll also notice the numbered dials on the sides. These are the dials that set the levels of resistance for inhale and exhale. They can be adjusted independently of one another. Number 1 is the lowest setting for both, and each increase in number is an increase in resistance. All right, are you ready to train? During respiratory muscle training with breather voice, we want to keep the following principles in mind. Technique. It's important to focus on breathing from the diaphragm during training. We're trying to strengthen both the muscles and the breathing technique that will give you the most efficient oxygenation during rehearsals, lessons, performances, and even everyday life. We'll go into more detail about this principle in the next video. Rhythm. We want our bodies to learn the rhythm of our breath during respiratory muscle training. In general, we will effortfully inhale for 2 to 3 seconds, pause slightly, effortfully exhale for 2 to 3 seconds, pause, and so on. If we take the time to focus on this rhythm when RMT is new to us, it will become automatic to our bodies. We also need to make RMT automatic in our daily routines. Consistent training will yield the optimum outcomes we are looking for, just like with any new skill. In general, we recommend doing 3 sets of 10 reps twice a day for 6 days a week. Some people prefer to complete RMT as part of their general morning routine, and then again before bed. A common example is after brushing your teeth. Others like to build RMT into their daily music training. Don't leave it to sheer will. Find the time that works for you and spend a couple weeks making it a regular practice. Alignment. During RMT, you want to position yourself with a straight back. This will allow your lungs to expand. Some people prefer to sit up straight, while others prefer standing. Choose the position most comfortable for you. We do recommend you not walk around during training, but stop and allow your body to focus solely on training your muscles of respiration. In the zone. This refers to the optimum effort for training. We can sometimes fall into the mindset that the harder we push, we'll get bigger, faster results. This is just not true. We also know full well that if we don't apply enough effort, we won't get the results we're looking for. During respiratory muscle training, aim to keep your effort in the zone, the 6 to 8 range on the breather voice effort scale. This is 60 to 80% of your maximum possible effort. When we train in the zone, we can feel the work, but we can maintain our technique, alignment, and rhythm. If any of those areas become compromised due to excessive effort, that's our cue to dial it back. Notice, as performers, it's important for us to be in tune with our bodies. How are you feeling today? Is it a recovery day following a performance? Or maybe you notice RMT is requiring less effort as you strengthen your muscles of respiration. The dial settings can change as often as your body directs them to in order to remain in the zone. Settings will increase gradually as you strengthen, but also should naturally decrease. For example, after recovering from an illness or even returning to RMT following a vacation. Or perhaps you decreased your settings to complete a gentler warm-up in place of your typical RMT on the day of a performance. Listen to your body and notice what you're feeling so you can train well each day.